We are seeing a surge of Mycoplasma pneumonia cases, and I thought it was a good time to talk about pneumonia in children. Hi, I'm Dr. Mona Amin, a board-certified pediatrician and mom, and we're discussing pneumonia, the different types of pneumonia, signs and symptoms, diagnosis, treatment, and more. Let's get to it. Pneumonia is an infection that inflames the air sacs or alveoli in one or both lungs. It is a common misconception that pneumonia equals bacteria, but in kids it's usually caused by viruses like the flu or respiratory syncytial virus or RSV. Pneumonia can also be bacterial. When the lungs are inflamed, they fill with fluid, making it hard for the body to get enough oxygen. This is why pneumonia can make breathing so difficult. We will get into the different types of pneumonia, but there is a current surge in Mycoplasma pneumonia, which is a type of bacteria. In 2023, Mycoplasma pneumonia began to resurge worldwide after low infection rates since the COVID-19 pandemic. Throughout 2024, CDC data has shown an increase in pneumonia-related emergency visits attributed to Mycoplasma pneumoniae, peaking in August and remaining high, especially among children. Between March and October 2024, diagnoses rose from 1% to 7.2% among children aged 2 to 4 and from 3.6% to 7.4% in ages 5 to 17, with the increase in younger children being particularly notable as they are not typically at high risk for pneumonia from Mycoplasma. This surge can be due to lack of exposure to Mycoplasma for many during the pandemic due to social distancing, mutations in the Mycoplasma bacteria making it more infectious to populations who may not usually get it, and cyclical outbreak patterns. Some illnesses just have surged certain years, and this may be the year for Mycoplasma. As a pediatrician, I know illness happens, and I know we do our best to reduce risk. But getting sick is not something we can always control. Remember that due to modern medicine and vaccinations in general, pneumonia is something we can treat, albeit it sometimes requires hospitalization. And Mycoplasma in particular is usually mild in that it doesn't cause severe illness. Let's get into the different types of pneumonia: viral, bacteria, and the star of the hour, Mycoplasma pneumonia. Pneumonia can be spread in several ways. The viruses and bacteria that are commonly found in a child's nose or throat can infect the lungs if they are inhaled. They may also spread via airborne droplets from a cough or sneeze. Mycoplasma pneumonia bacteria are spread by inhaling respiratory droplets produced when an infected person coughs or sneezes. Other people can get infected if they breathe in those droplets. Outbreaks can be prolonged due to the incubation period of 1 to 4 weeks. For example, if a child catches Mycoplasma, the incubation period is how long it takes from the moment they are exposed to the bacteria until they start to feel sick, meaning they can be contagious without even knowing it. And also, these outbreaks can be due to the nature of the bacteria causing prolonged lingering coughing. In children, viral pneumonia is the most common type of pneumonia and can impact all age groups. Several common viruses can lead to viral pneumonia, particularly in children. The most notable include the influenza virus, which is prevalent during flu season, and respiratory syncytial virus, or RSV, a major cause of pneumonia in infants and young children during the fall and winter. Other viruses that can cause pneumonia include adenovirus, parainfluenza virus, human metapneumovirus, and coronaviruses, including those that cause common colds and COVID-19. Bacterial pneumonia can happen in one of two ways: either acquired through the community or community-acquired pneumonia, or on top of a viral infection. If a viral infection has irritated the airway enough or weakened a child's immune system, bacteria may begin to grow in the lung. This adds a secondary infection on top of the original one, a virus. The most common bacterial cause of pneumonia is Streptococcus pneumoniae, followed by Haemophilus influenza B or HIB. Vaccination can help reduce the risk of these. However, due to changes in the bacteria or other bacterial pathogens or a person's immune system, bacterial pneumonia with these pathogens are still semi-possible. Mycoplasma pneumonia is caused by a bacteria, Mycoplasma pneumoniae. This bacterium is unique because it lacks a cell wall, which differentiates it from many other bacterial pathogens, and also the reason why certain antibiotics won't work for treating this. The typical age group is usually school-age children to teenagers, but we have been seeing Mycoplasma in toddlers as well. Mycoplasma pneumonia is often called walking pneumonia, as symptoms are not as severe as other bacterial pneumonia. Hence, they can walk around and be active still. So knowing there are various types of causes of pneumonia, what are the symptoms and how can we differentiate them? The symptoms of pneumonia can overlap greatly with viral upper respiratory tract infections. Symptoms of pneumonia can include a dry cough or wet cough, chest pain with breathing or coughing, shortness of breath or difficulty breathing, fever, chills, wheezing. Some things to note. Symptoms vary greatly from person to person. It is also possible that younger children may not always have a cough with pneumonia and may present more with difficulty breathing as the presenting sign. Also, fever is usually a common sign but can be absent in younger children or some cases. Babies can also present with grunting, nasal flaring, and in severe cases, bluish discoloration of skin or lips. Like I mentioned, the symptoms of an upper respiratory tract infection and pneumonia can look similar in children, especially because kids can have fever with regular viruses that we can also get. If your child has any of the following with what seems to be an upper respiratory tract infection, it's a good idea to get them evaluated to rule out a pneumonia. Difficulty breathing, chest pain, persistent fever more than 5 days, persistent cough that is impacting sleep, their function, life, symptoms that worsen after initial improvement. In children under 5 years of age who have cough and or difficulty breathing with or without fever, pneumonia can be diagnosed by the presence of either fast breathing or lower chest wall indrawing and outdrawing, which is called retractions. This is the job for your child's clinician and can also be difficult given overlapping symptoms. Viral pneumonia usually starts gradually, often after a cold or flu with a mild fever and a cough that may get wet over time. Bacterial pneumonia, however, comes on suddenly with a high fever and a cough that produces thick mucus. A doctor might notice wheezing or crackling sounds in the lungs for viral pneumonia, while bacterial pneumonia shows more localized sounds and signs of infection in specific lung fields. Tests like chest x-rays and sputum cultures help identify the type, with bacterial pneumonia often resulting in a higher white blood cell count. Mycoplasma pneumonia is called walking pneumonia because symptoms may not be as severe as other bacterial pneumonia, but it still would need treatment. Mycoplasma pneumonia typically has a dry, lingering cough that is persistent, which means it's there during the day, activities, and at night. A lingering cough from a virus may be present during laying down or not as bothersome during the day and will be more intermittent. Someone with Mycoplasma pneumonia may also have fevers such as 100.4 or 100.6, so they're not spiking high, but they have lower fevers showing something is active. Mycoplasma pneumonia should be suspected in the patient who has a lingering cough with or without fever, but is overall still listless and not at baseline. So maybe tired, a little bit achy, a sore throat, fatigue, not at baseline. If your child has a lingering cough but is running, jumping, sleeping, and active, mycoplasma is very unlikely. For more on chronic coughs and when to be concerned, watch this YouTube video. So taking all of this information, when should you get that cough, fever, or URI evaluated for a possible pneumonia? Persistent fever over 5 days. If at any point in the illness the child is dehydrated or having difficulty breathing, inconsolable or seems to be in pain and pain-reducing medicine like ibuprofen or acetaminophen are not helping, persistent vomiting or abdominal pain, which can be a sign of lung involvement impacting the digestive system, a persistent cough past 3 weeks where the child is listless, not at baseline, or the cough is impacting sleep or functioning. Again, watch this YouTube video on persistent cough for more. If your child has underlying medical conditions like asthma or is immunocompromised and you are concerned. A clinician usually makes the diagnosis by your child's history and physical exam. We will look at vital signs, including respiratory rate, temperature, and oxygen saturation, listen to their lungs, and see their overall hydration status, and ask you for a history of symptoms. If the diagnosis is unclear, other diagnostic tests include chest x-rays to identify areas of lung consolidation, as typical bacterial pneumonias would typically show up in an area of the lung, and basic blood work looking for the white blood cell count in a complete blood count, or CBC. For Mycoplasma pneumonia, a PCR can be taken from sputum or saliva or throat swabs, and similar tests can be done for a concern of a bacterial pneumonia. Many times, however, the diagnosis is clinical without testing. If you are concerned your child is unwell and may have pneumonia, you can ask for these diagnostic tests and have your child's clinician determine the benefit or need of them based on your child's symptoms. Treatment for pneumonia varies based on the cause, viral, bacteria, or mycoplasma. Viral pneumonia is typically managed with supportive care, including rest, hydration, and over-the-counter medications to alleviate discomfort from fever. If your child has the flu, they may also get an antiviral medication. Bacterial pneumonia generally requires all of the above and antibiotics, with the choice of antibiotic depending on the specific bacteria identified or locally what's happening in your region. Common antibiotics include amoxicillin. Mycoplasma pneumonia is also treated with antibiotics, with the most preferred antibiotic being azithromycin or doxycycline, as mycoplasma bacteria lacks a cell wall, making them resistant to amoxicillin. Depending on the child, they may need albuterol treatments for associated wheezing. If a child is admitted for pneumonia, the reason could be for monitoring of vital signs, respiratory support, or additional hydration, with children having good outcomes. Sometimes follow-ups are needed to confirm your child is doing well. Monitoring of breathing status and possible changes of antibiotics are sometimes necessary. Monitor your child for the following after starting treatment for pneumonia: a fever lasting more than a few days despite antibiotic treatment, a fever that resolves and then returns and persists after a few days, difficulty breathing, increased lethargy and sleepiness, red and swollen joints, bone pain, neck stiffness, vomiting, or any other new or concerning symptoms for you. Now let's get to some pre-submitted questions from the PDT community about pneumonia. Why is my child's cough still lingering after antibiotics for pneumonia? Coughs can linger after pneumonia even with antibiotic treatment for several reasons. First, pneumonia causes inflammation and irritation in the airways, which can persist after the infection has cleared, leading to a prolonged cough. Also, viruses can occur with the pneumonia, which can linger even if we say a bacterial pneumonia was treated. Additionally, the body may experience a post-infectious cough that can last for weeks as the respiratory system heals. Residual mucus accumulation in the lungs may also take time to clear, prompting ongoing coughing as the body attempts to expel it. Of course, if symptoms are worse, seek an evaluation. We know pneumonia management works if the child's symptoms are improving and not worsening. Why did my doctor not prescribe a cough suppressant? My kid is struggling. I get it. Coughs are hard for everybody, but they are oftentimes protective. Cough suppressants containing codeine or dextromethorphan are generally not recommended. Coughing is helpful in clearing the excessive secretions caused by the infection, and thus suppressing it can cause more mucus and inflammation to settle in the lungs. This is especially important in young children or asthmatics or those with underlying medical conditions that make pneumonia more likely. Why won't my doctor just give my kid antibiotics for a lingering cough? Not all coughs need antibiotics, and not all lingering coughs are pneumonia, especially walking pneumonia. Antibiotic overprescribing is rampant, and I commonly see azithromycin or Z-Paks given out like candy for all lingering coughs, saying it's walking pneumonia. It's understandable to feel frustrated when a doctor doesn't prescribe antibiotics for your child's lingering cough, especially when it seems like it's an easy solution. However, remember, most coughs are virally induced and antibiotics won't help. Also, antibiotics should only be used when needed to minimize risk of side effects and antibiotic resistance. So don't demand antibiotics. If you are concerned about your child, you can ask for other diagnostic tests that make sense for your child before demanding that prescription. Cardinal rule: fever-free and fever-reducing medicine-free for 24 hours, and your child's symptoms have improved where they are almost back at baseline. If your child is on antibiotics, they can still go back to school as long as previous mentioned things are okay. Your child's clinician can provide further guidance on return to school if needed. Prevention strategies for pneumonia include similar precautions for all respiratory illnesses. Encourage regular hand washing with soap and water, especially before meals and after using the restroom, to reduce the spread of germs. Make sure your children are up to date on vaccines, especially the pneumococcal vaccine and Haemophilus influenza vaccine, which thanks to these vaccines, we don't see as much pneumonia from these culprits as much as we saw pre-vaccination. Stay home if acutely unwell or with fever to reduce the spread of germs when most contagious. There you have it. Pneumonia can be a serious concern, but most children recover fully with the right care and support. By staying vigilant about symptoms and understanding prevention strategies, we can help keep our kids healthy and resilient. If you found this video helpful, please give it a thumbs up sign, share, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. As always, comment below with any questions, comments, or personal experiences about pneumonia. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.